The mosquito barely noticed, easily dismissed, remains one of the deadliest animals on Earth, not because of its size, but because of what it carries. Mosquito-borne diseases such as dengue, malaria, Zika, chikungunya, and yellow fever infect hundreds of millions of people annually. Yet mosquito-borne diseases are not inevitable, they are preventable. We will explore how mosquito-borne diseases work, why they remain such a global challenge, and what we can do to stop them together. Mosquitoes might seem small and harmless, but the disease they carry are far from it. Mosquito-borne disease, or MSDs, affect millions of people worldwide, particularly tropical countries like Malaysia. These diseases include dengue, malaria, Zika, and chikungunya, and they are a serious public health concern. In Malaysia alone, tens of thousands of cases are reported each year, and outbreaks often spike during the rainy season when stagnant water provides ideal breeding grounds. Cities are especially vulnerable because high population density and construction cities create more opportunities for mosquitoes to thrive. Even though we might see mosquitoes everywhere, understanding their behavior and the risks they pose is the first step in protecting ourselves and our communities. In this video, we will explore that MSDs are, how they spread, the symptoms to watch out for, and most importantly, how we can prevent them.
Malaysia's tropical climate provides the perfect environment for mosquitoes to thrive year-round. As a result, mosquito-borne diseases are reported across the country every year, and some regions are more affected than others. Among these diseases, dengue is the most common. Tens of thousands of cases are recorded annually, and during the rainy season, the numbers often spike because stagnant water accumulates in everyday objects. Urban areas face particular risks due to high population density, construction sites, and limited drainage. Mosquitoes can breed in unnoticed small amounts of water around homes and neighborhoods. Over the years, factors like urbanization and climate change have made controlling outbreaks more challenging. This shows mosquito-borne diseases are not just occasional problems, they are ongoing public concerns that affect communities throughout the country. Understanding the scale of the problem helps us see why awareness, early recognition, and preventive measures are all so important.
In the heart of the peninsula, urban centers like Shah Alam having 55 recorded cases and Kuala Lumpur having 124 confirmed cases serve as the primary battlegrounds. Here, rapid development and high density living create a complex web of breeding sites, but the threat extends further. Across the water in Sabah and Sarawak, the virus finds a home in the humid tropical reaches of East Malaysia, putting up numbers of total 73 confirmed cases. Next, this bar chart showcases confirmed cases of dengue in Malaysia across 4 years from 2021 to 2024. In 2021, there were 20,000 confirmed cases, which jumped to more than 60,000 in 2022. By 2023, cases rose to more than 120,000, and 2024 is currently hovering in the same area, with Selangor maintaining the highest number of cases. Next, the timeline of dengue in Malaysia starts in 1954 with the first serotype isolation, where dengue was found in Kuala Lumpur. In 1962, the first laboratory confirmed DHF case was reported in Penang, involving 61 cases and 5 deaths. During the 1960 and 1970, the phase of endemicity saw all 4 serotypes circulating, leading to the first national epidemic with more than 1,400 cases. In 1973, a massive outbreak of over 5,000 cases and 54 deaths resulted in dengue becoming a notifiable disease. The year 1988 set a new record with cases jumping to 27,381. Finally, the period of 2014 to 2019 saw historical peaks with 100,000 cases in 2014 and a record 130,000 cases in 2019.
Mosquito-borne diseases often start like everyday illnesses, which is why they can be tricky to spot. Common symptoms include high fever, severe muscle aches, joint and muscle pain, nausea, and fatigue. Some people may also experience rashes or eye pain. In dengue, severe cases can lead to more serious complications such as internal bleeding, shock, or organ failure if left untreated. Malaria, on the other hand, can cause recurring fevers and chills that may become life-threatening without prompt treatment. Even mild symptoms shouldn't be ignored because early recognition and proper care can prevent serious complications. Being aware of these warning signs not only help protect yourself, but also your family and community, as timely action can stop the spread of disease.
Mosquitoes-borne diseases are spread mainly through the bites of the Aedes mosquitoes. These mosquitoes have unique habits. They prefer to breed in clear stagnant water, which can be found in everyday objects like buckets, plant pots, and even discarded containers. Aedes mosquitoes are day beater, which makes avoiding them tricky, especially in urban areas where people are outdoors a lot. One infected people can source of an outbreak as mosquitoes bite multiple people in same community. Understanding mosquitoes' behavior helps us to prevent is so important. By controlling, protecting ourselves, we can stop the chains of transmission before it spread widely. Remember, it's not just individual action that matters. Community awareness and collective efforts play a huge role in reducing the spread of this disease.
A mosquito bite may look small, but there is a clear reason behind it. When a mosquito lands on your skin, it uses a thin mouth part to pierce the skin and suck blood. While biting, it releases saliva so the blood can flow easily. Only female mosquitoes bite humans. Blood is needed for one reason only: to make eggs. Blood gives female mosquitoes the protein and iron needed for egg growth. Without blood, the eggs cannot develop. Mosquitoes have 4 life stages: egg, larva, pupa, and adult. After a blood meal, the female lays eggs in standing water. This is spread when a mosquito bites an infected person, then bites another person nearby. A small insect, but a serious danger.
Fortunately, mosquito-borne diseases can be prevented with relatively simple steps if everyone does their part. Start at home, check for your surrounding for any stagnant water in buckets, plant pots, gutters, or old containers. Mosquitoes can breed in even the smallest amount of water. Secondly, use mosquito repellents when you're outdoors, and make sure your windows and doors have proper screens to keep the mosquitoes out. Thirdly, community action just matters as much. Talk to your neighbors, organize cleanup days, and ensure public areas are free from any stagnant water. When the community works together, the risk of outbreak drops significantly. As students, we can also make a difference by being aware, spreading information, and following these habits ourselves. Encourage others to do the same.
Mosquito-borne disease may affect all of us, but prevention is something we can control.
By understanding how and where these diseases spread, we are able to reduce our risk significantly.
Recognizing the symptoms early can save lives. Don't ignore even mild signs of illness.
Remember guys, from home to neighborhood, let's keep our communities safer and clean. Let's do it together.
Every small step counts. Remove stagnant water, use repellent, and spread awareness.
We can fight mosquito-borne disease.
and protect our community.